The IWG was initially formed to mobilize efforts of communities and civil society in India leading up to the preparatory meeting and pledging conference, which was hosted by President Macron of France. As part of the objectives of the IWG, they worked together with other communities and civil society stakeholders to advocate for the doubling of the pledge of the Government of India from the Global Fund's fifth replenishment. The IWG remains actively engaged in domestic resource mobilization efforts and advocacy on ensuring people-centered health outcomes towards achieving universal health coverage.
India Working Group has come together to advocate with a specific three asks. Our first ask was that Government of India doubles its contribution to the Global Fund in the sixth replenishment. Our second specific ask is to the Global Fund, requesting them not to leave India as a country and continue working in India beyond 2025. And the third ask, which is going to be our future plan also, is to Government of India, requesting Government of India to increase the GDP spending on health.
The India Working Group for Health Advocacy, that is IWG, would like to ensure that communities and civil society organizations are part of designing policies, strategies beyond service delivery. That is, inclusiveness should be a priority. In addition, the India Working Group would also like to ensure there is sufficient funding for malaria responses with prioritized allocations for community system strengthening.
Create champions, health champions who can have a very detailed understanding on macroeconomics, the health financing, and they can take this learning down to the grassroots level. We all know in India, like the entire HIV, TB, malaria is centrally funded, but yet we have to understand the key nuances of health financing, how the budgets are prepared and how the expenditures happen, and what are the pressure points where the champions have to do advocacy, so at national level, at state level, and below that.
And this is what we have done over the past 2 years in speaking to all the different stakeholders, be it the parliamentarians, the ministers, the national programs for TB, HIV and malaria, of bringing together on a same platform all these different actors and also dialoguing with the private sector.
When the COVID-19 pandemic struck, like a lot of other people, it was very difficult for us to continue with our traditional form of activities, as in meeting people physically and stakeholders physically. So we had to resubmit the new set of activities in a new proposal.
Two activities which I could undertake are organizing a series of webinars for malaria, tuberculosis, HIV/AIDS and COVID-19. A large number of people from all over India participated in this webinar series and echoed their concern on this elimination of these four diseases. The second activity which I could undertake is organizing a citizens charter to be included in the election manifestos of political parties.
India Working Group has provided us a training and a platform where we understand the current health system and their finances, and under that training we build our capacity. We have discussed in detail about the need of the community and how the budget is supplementing or like fulfilling the need of the community.
We have a flagship program in India HS Alliance called Summer. So through that program we're implementing this campaign, and definitely we try to message on various issues related to gender and sexual minorities. Through these messages we also reach out to population to talk about IWG and the Global Advocacy Network. And as I shared, we reached to 5,000 population, and I think this will be a very good initiative to further strengthen, to get more awareness on health right advocacies and to strengthen it further.
I would like to thank the India Working Group and all its partners for undertaking the online malaria quiz during this COVID pandemic. It was indeed a big success for us. People participated from all walks of life. In fact, I got feedback from many of the participants saying that their level of knowledge was enhanced by participating in this quiz.
Being a community champion, we had a higher responsibilities with the work that we were supposed to do. But moreover, this was the first time when HIV, TB and malaria civil societies were coming together. That togetherness was very important because we were having one voice and we were working for one objective. That objective was basically to strengthen our engagements and resources and contributions towards the global fund, because that same money comes back for a civil society engagement.
So all of this wouldn't have been possible had it not been for the support of APCASO and GFAN. I must say that the tremendous support that was received in order to host the IWG at Alliance India made it possible for the phenomenal advocacy efforts that resulted in the most appropriate domestic commitment for the sixth round Global Fund replenishment. But in addition to that, I wouldn't be doing my duty if I didn't put on record the tremendous partnership and the synergy between the National Coalition of People Living with HIV, GCTA and Caritas for coming together in this beautiful partnership, and I hope it flourishes.